Hi, my name is Dr. Matteo, and welcome back for part 2 of my 3-part series on fibromyalgia. In this part, I'm going to go over what are the classic characteristics of someone who has, quote, fibromyalgia. And if you watched my last video, that means that you have a problem with your adrenal glands, or rarely, possibly your pituitary gland. So first of all, probably the most common cause of fibromyalgia, or cause of, let's say, adrenal fatigue or adrenal failure, which are the most common terms right now, and that's where you're going to find your information on the internet and Google, is looking up adrenal fatigue or adrenal failure. So you could be the person that is very driven, type A personality, you've been that way your whole life, the type that burns the candle at both ends, and that does take a toll on your body. When you live your life that way, what it does is it causes your adrenal glands to be working constantly and secreting adrenaline and cortisol on a regular basis, too much than they're used to doing. And like anything else, if you use it too much, it's going to fatigue, it's going to get tired, it's going to get worn out. And when that happens, the adrenal glands' ability to produce those hormones goes down. So you're used to getting these hormones, your body's used to it, and it's almost like getting a drug. And as it starts to diminish, your body starts craving energy because it's been driven by these hormones for such a long time. So you start reaching for things like more sodas, more coffee, a lot of sugary type foods, a lot of salty type foods, because the other thing the adrenals do is they control your blood pressure, and salt has a big effect on that. Anything to keep you going is what you're going to be looking for, to keep it going. But eventually, even those things will stop working, and you're going to find yourself getting so fatigued that you just feel like you can't get enough sleep. You're in bed all the time. Even if you're in bed, most likely you have a really hard time falling asleep, which is kind of strange, but it's the way that it works, because your hormones are so screwed up that you can't even get into a normal sleep pattern. So you're sleeping at odd times of the day, if you can, and typically not at night. So that's probably the most common person who develops adrenal fatigue or failure, or, quote, fibromyalgia. Now, you could also be the person that just experienced a devastating loss of some kind, an unexpected death in the family, a divorce, a serious car accident or other accident of some kind where there's really terrible injuries and it has a psychological effect on you. Any of those things can have the same exact effect on your body as being a type A personality for your whole life. The bottom line is your body has to be in the fight or flight mode a lot more, way more than it should. And eventually the glands, the adrenal glands that produce those fight or flight hormones, get tired and will eventually stop functioning. If you remember back to the 50s and 60s, people used to have what's called a nervous breakdown. And a nervous breakdown is a adrenal failure case where your body will no longer make any adrenaline or cortisol, and it just stops functioning. And it typically takes months and months and months to recover from that, with just rest in a dark room somewhere. But like I said a little earlier, there is hope for you, for the fibromyalgia patient, for the adrenal failure patient. It takes some doing on your part, but I've seen and helped dozens of fibromyalgia patients, and the ones that follow my recommendations by the book to the T simply get better, and they're able to return to a normal, productive life, free of pain, free of fatigue. So I want you to know that there is help. In my next video, I'm going to go over how you can help yourself, and with my help, hopefully eliminate the symptoms of fibromyalgia. So thank you for your time today, and I'll see you on part 3. Have a great day. Bye-bye.